Um, Good afternoon again. The title of our presentation today is Inclusion and Diversity in Context of Hospital Pedagogy. This is a little bit the continuation of what we did last week with Christoph Schneider, but I confess this is a thematic that I bring with myself as migrant and living in around 25 years outside of Brazil, and I love this word diversity. For today, we have these points. We will see a video. It's a video from Denmark that speak about diversity and what connect us and about bias. Then we have some guiding questions. Then I speak about 4 points about diversity in hospital settings. Then chronic illness is now standard. It's the situation that I have to say already that we are living in Germany. I bring some studies to point the what happens right now here, and then why it matters. This thematic not just for people that study to special schools, but for all teachers. Um, then you have another activity, and then you have a presentation about this activity, and I show you the literature. Um, for start, I just go show you a video. It's a 3 minutes video, and I need a feedback if you can listen this video. Just 1 minute. Rosa, can you listen? Can you listen the video?
No, unfortunately not. But it has
No.
subtitles, so it's okay.
But why not? Just 1 minute. Thank you. Uh, Um, Christina, could you follow the test?
Yes.
Yeah, kind
Yeah.
of.
Okay. Anyway, stay in the presentation that I sent to you. This video show how people are different physically, but how at the same time we are full with emotions. And when you do some question, you see that we are at the same point or at the same synchronicity, but you have to go behind the appearance of the people. Yeah? And this is the connection that I want to do with the, or this is, we can see later how that we share. We are always have the tendency to put people in box when you see for the first time. This is our normal conditions to, in few seconds, put in a box someone. But what happens when this happens in the hospital context? Or I don't say just hospital context, also in uh, not just in the hospital context, but also in a school context. Yeah. And now the first questions, which quick judgment did you catch yourself making during the video? And how could similar automatic judgment harm hospitalized children and family? But maybe if you don't get this video, we should let's say like this. Let's say take three minutes and look this video in YouTube and try to answer this question here. Okay? Because if you don't see really the video, then it's difficult to understand the two questions that you have now. And this is important to follow the section. Just a minute, I will take the link for you. So I put the video here, and maybe it's better now to you following the situation. Did you get it? let's come back here. Could you see better and understand better the videos? Can someone say something?
Yes, it was better now.
Mhm. Did you have all this same feeling, Christine, from quick judge at someone when you see the appearance, like me?
About the video, I noticed two things. When they showed these people in like baggy shirts and pants, like hip hop style, I somehow felt like I respected them more and maybe was a little bit intimidated. And the other thing, they said something about these are the religious ones, and then they showed just people in football shirts, and I was a little confused because they didn't seem really like the religious picture that I had.
Uh-huh.
Yeah,
But
that's the only
football is a
thing.
religion many times.
Yeah.
Uh-huh. But I understand what you mean about the picture about religion. It's right. And now the point is, can you just do a bridge between how could similar automatic talks of people harm a hospitalized child, and not just the child, out the family? And Christina, today it's wonderful because we have Rosa here, Rosa Maria working in the hospital in Italy. And I think it's always wonderful when you can contrast what you talk here, what you discuss in theory, with a practical person that are in the practice day by day. And Rosa, you are free to say your opinion today, what you are discussing here. Something that I wrote for us today that can be really important to don't think too fast or judge too fast on children. It's take care about our bias exposure. Yeah. Um, and child that is in hospital, you can think that she's lazy, unmotivated, or she don't want to try, but in the background, in fact she's just lying with pain in the bed. Yeah. And this is some risk that you can bring to our work when you have wrong expectations, and we don't trust. I think this is an important work during the hospital pedagogy when you trust our child and children's, yeah, and also in the school. In this point, this is something that people that work in the hospital knows that sometimes that happens with me. We can have a nice planification what I want to do this day in the hospital, and then we arrive there and you see that have a situation that was not good, or the night was not good, or someone died, and all this plan that you prepared for this day, you just have to throw away and be flexible and see what you can do in this day, in the hospital. In this point, we can think fast when you judge one child, but in the another point, we have to think fast to change the mentality to support the children in the hospital when have a situation that we cannot identify why people are sad or why the children are angry. And in this point, it's important that we have this emotional, I say that emotional intelligence to work better with the children in the hospital. Another important question is about the invisible diversity. The video shows visible difference. In hospital pedagogy, most differences are invisible. And the questions, which invisible factors could you easily misinterpret when, and how would that misinterpret, exclude a learner. Let's think a little bit. And again, I did this by myself, all these questions. And in my experience, I wrote something here, but please, if you have something to add or to criticize or disagree, you are free to explain now, okay? This is some invisible diversity that we don't know when you arrive to work in the hospital, or, again, or in a school, if a child have pain, and that way she have excuse. Cultural silence, we can interpret it as this is disinterest. Maybe it's not like this. Anxiety, treated as no compliance. And it's in that point, Dr. Asher, that here in Germany, we try to don't put too many children in one class. 30 students already too much. Do you have too much? Do you give too much the correct attention for these children? When you are in the hospital, we are more comfortable with less child. We could see this in some hospitals here in Munich, because we need this attention about the emotional issues from this child to work with them in these days. And this is something really that you have to say to the teachers. Don't be too fast to put a label in one child in the hospital. And I say not just in the hospital, I say to at school. Yeah. When you go to Rosa, do you want to agree or disagree with something? I love when someone disagree with me and bring some new points. And please be free, okay, Rosa? Now I go past to another point. That is the medical diversity that we have, the diversity that you have in the hospital setting. One of the is in the right is the foundation for hospital pedagogy. When you go to the hospital, no one chooses to go to the hospital. That means when you go to our oncology, you have many students from many different backgrounds, and every illness creates its own rhythm, its own limitations, its own cognitive patterns. And if a teacher plans lesson as if the student were health, inclusion fails instantly. Not because of attitude, but because the lesson clashes with the child's medically reality. Again, the point more important here is the flexibility and to understand the context of this patient, this children, this student. What is the treatment that he's doing? Yeah, are this patient the first time in the hospital or are 1 year in the hospital? This is all things that you have to take care when are working in the hospital setting.
May I add something to that?
Yeah, please.
Just because you said you were lucky to have some Rosa as a teacher in hospital settings. I work in a hospital as well with on an oncolog, yes, with children that are treated for cancer. And just yesterday it happened. I had 2 lessons planned for 2 children. We also teach them individually. One child had left the day before because his blood tests were so good, and he didn't know that he was allowed to leave the next day, so he wasn't there anymore. And the other child had such a headache that she said, "No, I can't work today." So that happens as well, and you have to respect that. And yeah, so just to add to your own experience.
Yeah. And this is the flexibility that I think we that work with hospital pedagogical special education, we have a lot. This I saw this when I was in Dublin this year in the Hope Congress. And my question, it's always to think how can we spread all this flexibility, love, and empathy to normal school. This is the question of my life. I don't know, but I think we have to work in this direction. Thank you for
That
your.
would be wonderful.
Hmm?
Spread this out to normal school. Yes, that would be great.
Yeah, yeah. I think we have to work together with these people and yeah, and build a bridge between special education, hospital schools, and the regular schools. This is what I think it's a small work that you are starting to doing. In the reality, we start already. Um, we speak about the diversity in the hospital set, the medical diversity, and now I will speak about the socioeconomic diversity. And this is something that I really don't know how deep people that study to be teacher learn about sociology. This is we have Pierre de Bourdieu, and he speaks that a person's social position in society determines the perception, they think, and the action. And this is something that I really live with me because in Brazil we have a big social difference. Like, for example, this build from Tuca Vieira. It's a reporter from São Paulo. He take this picture and he presented this in London in the Tate Gallery, and the people are thinking that this picture was a collage, but it's not a collage. And I know this place. This is Paraisópolis in Morumbi. Two Stadtteil, I don't know English, two part of the city divided for wall. In here live the rich people. Everyone have an apartment with a private swimming pool, and the another one it's a community. Yeah? And there is two different socioeconomic reality that you have to be in consideration when you work. Sorry, again, I go speak about the oncology because this is my background, but I have this experience in Brazil to have family from these two different setting. One family from a community, a poor community like this one, and a family that the father was pilot international flights, yeah, and they are in the same place in the oncology, and we are playing together, yeah. But when you are working with these people with the thematic of education, you have to be realist, yeah, that we are talking about inequality of resources, family conditions, parent support, yeah. If you work with someone that live in Morumbi, the parents have at least a good qualification to explain mathematics or physics or biology for your child. But people that live in this another site in Paraisópolis, it's another condition. Another point is the financial stress that impact the children too. Yeah, and this is something that I think our teachers, we have to be realistic and understand which background have our students. Again, I'm talking about hospital pedagogy, but I think this is really important to understand in the school setting, in the normal school too. Now let's go to another diversity. This is something really important. It's the cultural and linguistic diversities that play out sharply in hospital setting. Last month I was visiting a hospital in Zurich, and it's incredible the diversity that you see there. Muslim people, Jewish people, Catholic people, just to talk about religion. Families may have different beliefs about illness, different expectations of school, different ways of expressing distress, and children may appear quiet, but this might be cultural politeness, not disengagement. And this is something that we have to develop in the teachers in the hospital, in the teachers at school. This sensibility to understand this cultural and linguistic diversity, what these children want to tell to us. Teachers totally overestimate their own cultural competence. And I say this when I talk with me. Sometimes you think too fast and want to take too fast conclusions. And I think this is a every year or every semester work. Think about how is my cultural competence. This is something that I do for myself too. And then if you do this, you can avoid misinterpretations that push families away and weaken trust. Also, inclusion in this point demands cultural humility and not assumptions. And as I received before in the video, we are too fast to to get assumptions for someone despite the characteristics of the body or of the clothes. Another point, it's the diversity. It's about the emotional and psychological diversity. It's sure when a child is in a hospital, it's not just sick. They are exhausted, they are emotional, vulnerable, they can have a trauma, anxiety, aggression. And these are not behaviors to correct, but they are symptoms to understand. And this is the point that we have to be aware, is to understand this point, these symptoms of these children. Yeah? Interpreting emotional response as defiance or lack of motivation. You just have to be patient and understand what happens emotionally with these children. If you really want to work with inclusion at schools, at the hospital, this is something that I think it's the core. You have the inclusive practice is understand this emotional and the psychological diversity that the students bring to us at school. Now I give a jump not to the thema hospital pedagogy, but for the chronic illness as standard. And here I have to put in parents. I show some studies from Germany because I'm living here, and then I have to read many things or studies about this thematic here. In chronic illness, it's not a special case. It's that way that I think this knowledge is not about just hospital pedagogy. It's because it's normal in school today have children with chronic illness. Yeah? And the same is not Andre Gomes that say this, but it's these studies. You see that you have many children's. This is, for example, in a longitudinal COPSI study that showed a significant increase in psychological stress among children and adolescents during the COVID pandemic, with a decline in mental health strain following infection waves. Now we have now it's gone down, but we cannot suppose that everything is fine after COVID. And I bring studies just after COVID because I think everything that we publish with statistics before COVID, it's not more valid. Here in Germany, we have these many studies, and most of them show the same direction. This is the last one from the German School Barometer. They show that why are the children's fear. And now it's about war, academic pressures, climate change. And this publication from last year, they show that 21% of the students have signs of mental health abnormalities. I think this is too much, but this is a number that came in the another studies too, between 17 and 21%. Yeah, that means if you are in the normal school with the 30 students, you have at least a couple of them with some abnormalities, mental health. And this is something that you'll be aware. If the people in the regular school are aware of this, it's another point. And I don't know. I'm really confused right now. How can we address the teachers that have a lot of work, a lot of stress, to be aware about the condition of these children? Because something that we know, I talk a lot with teachers, it's that they always say, now you have to do inclusion, we have 30 children in the class, then you have to put 2 with autism, 1 with diabetes, another 1 with schizophrenia. I cannot manage this, and I understand them in the reality. This is another study from 2020 that say that teachers are not prepared, as if there's a gap, competence gap, to take care and to be safe and to feel safe to teach these children. Congenital heart defect, emergence, hypoglycemia, and diabetes. It's a high number of people that feel unsure or very unsure to give class for these children. And we have to take actions to give this safety for these teachers, in my opinion. Another interesting point is that we have this United Nations Convention on the Rights of Persons with Disabilities. This is a legal inclusion policies. Tanzania have this too, Guatemala have this too, but you can see that the reality, it's really different. We don't have consistent training for the teachers, have a lack of medical support staff, and high fear of responsibility for the teachers. And as I said before, I understand them. I think we need to have another frame to make the school a safe place for these children and also for the teachers. In this context, I have to say that in September, I have been in Uzbekistan, and now we came back in the video and the judgment or what you think about one country, one nation. I have no idea what I was waiting to me in Uzbekistan. We think in camel, Bedouins, I don't know. Came many things in your head about Uzbekistan. And then I was so surprised when I arrived there, how clean are the country, how friendly are the people. And then I was visiting schools. I was visiting the hospital school and I was visiting normal school. And Rosa, I get a shock. I listened, someone was crying. I say, what happens here? And then the teachers bring me there. Was a room with 2 nurses. The nurses are giving injections in the children's, vaccination the children's. They say, why the nurses are here? They say, no, this is normal. Every school have at least 1 nurse. And I say, what? Say, yes, every school have at least 1 nurse. In this school where I have been, in Samarkand, was 2 nurses. I have 1 in the morning and 1 in the afternoon. And then I was thinking, wow, how powerful is a nurse in one place, in one school, because they can really give a lot of medical support when a child have an emergency, when a child with diabetes have a hypoglycemia, yeah? Or in this school, a child have epilepsy, but no one was afraid because they have the support of the nurses. And I asked myself, why rich countries like Germany, why we cannot have nurses at schools to give this support for the students with chronic illness? Why you cannot learn this with Uzbekistan? Yeah? And I was so surprised, I have to confess here, that when I left the school and I was already in Tashkent, I started to ask the people in the hotel, did you have a nurse in your school? And they say, yes. It's something really normal there, yeah, for my surprise. Things that we have to learn. Why it matters? Take care about the childrens. Take care about these students with chronic illness. We know that all these people have a lower academic achievement, reduced participation, social exclusion, lower future occupational and social status. They take care about this body image, they have troubles with identification, motivation, peer relationships. And this is this sensibility and awareness that we have to bring to our students, to our teachers, to work better with the children and give the support for them. If you do this, we can avoid all this problematic of that social exclusion. It's a point, yeah. We are just talk about school, but we have to take care about the family too. It's a big bucket, but now I'm just talk about the support of school and how can we support these children through this illness. Yeah? I think we as teacher, we can do a good job if you have conscience about the power that we have in the educational setting. Now, let's do a small activity. I will show you 3 cases. And now let's think together where inclusion fails first. Yeah. The students identify the real points where inclusion collapse for chronically ill child using the evidence for the what I showed before about the diversity that you have in the hospital. I will show you 3 cases. The profile A, 10 years old with leukemia, undergoing chemotherapy with severe fatigue, occasional cognitive slowing, miss a big part of school, she lose the hair, and avoid stay with another children. The profile B, depression, a severe episode, 15 years old, hospitalized twice in the last year with a lot of irritability, with sleep disturbance, that means poor concentration, high risk for school refusal, and teachers quickly label them unmotivated. And then another one, 12 years old with diabetes that need insulin management during schools, risk of hypoglycemia during class, and teachers feel insecure and avoid the responsibility. Yeah? And the students fear stigma. This is the hidden symptoms. Now, the point is what is one of adaptation that would have the highest impact. What do you think? I showed already the answer, but I don't think you could read. Which hide the risk of for exclusion can you see in these three profiles? The floor is open. Or maybe you don't understand what I mean. I just want to ask you, which hiding risk for exclusion have these three persons here in these three different illness context. For example, a child in the profile A, Rosa, with a leukemia, they can be misunderstood because they fatigue, have a unrealistic expectation of teachers, and when you see that avoid peers that have risk of social isolation, right? And which risk have some children with depression. Okay, no one will talk, I give the answer. My answer, yeah? Maybe you have another one and you'll be free to see. Okay, if you want to write, can you write it to Rosa? Someone with depression.
I suppose social exclusion as well, isn't it?
Yes, please.
If social exclusion as well and reduced participation. So most of the aspects also apply to profile B, I would say. Also body image, things like that, all that comes with those aspects. Altered identity, motivation.
Motivation. You can talk here about the communication with the parents. Yes, what can we as teacher, how kind of communication you can get with the parents to understand more the situation of this child. And student with diabetes, a high risk of exclusion, and this I did a work with the students paper about this thematic, diabetes, and a higher risk it's the emergence mismanagement. Many teachers have fear, they are afraid to do some mistake if they do something some mistake in emergence case if they shouldn't have some problems with the insulin. The stigma can be a hiding risk, academic inquiry during fluctuations. Maybe the children are not good and you do some questions for them and they cannot understand. This is something that we need really to be sensitive and empathic to work with them and understand this is a hiding risk of these students. Let me see here what using music. Just 1 minute. Let me see here. I have the in order to that I am school cheater. Okay, Jose, you're a school cheater, right? Yeah. At the end, we are talking about sensibility. And what is one adaptation that would have the highest impact? Yeah, again, this is something that I think how this adaptation can prevent an exclusion. Yeah, you have to identify this one high risk point where the student will be unintentionally excluded. Yeah. But again, for this identification, we need time, you need sensibility, and we need to want to work with these children. Yeah. Which diversity layers are being ignored: medical, cognitive, emotional, social. I don't know. Any case, it's one case, and you have to be aware about this thematic. What is one adaptation that would have the highest impact? Each situation you have to see that you can find maybe flexible deadlines, protect breaks, emergent protocol clarity in case of diabetes, for example, and quiet space if the student need a place to relax or to be alone. Alternative assessment format. This is all strategies that we can develop to give safety for this student. When I was in Portugal doing my PhD, I saw how a child was so welcome in school. When she came back from the more than 4 months in the oncology, she came back without hair, but the mother told the class that she is coming, and she have no hair, but she have something in the head to cover, yeah, the head. And when she came back at school, all the classmates have the same like hair, a bandage in the head, and they have a wonderful integration in the school. Really, really wonderful. In the another side, I had a student that when he came back to school, he had no hair because the chemotherapy, and he was using a cap. In the school, you cannot use cap. And one of the students in the class just throw away the cap of him, and he was without hair. And then people start to smile and say thanks to this student. And just in this situation, the teachers explained to the class that this student did are doing it was doing a treatment, and that way he have authorization to use the cap. But for me, that was too late. No? But this is yeah, two examples for two different social class. One of school was a private school. Another one was a school with many, yeah, problematic countryside. But I don't think this is a reason to don't have a good communication between teachers, hospital teachers, and classmates for these students. I think this is something that we can avoid if you work better with communication. Yeah, this is what I have to explain today, and now I would like to know if someone have something to share about what we talked today, or if you don't want to share, if you want to write something, but something that I really like is have discussions in my class. It's about discussion, but with the internet, it's not, people are not so able to discuss. But please be free to say something. The important to know what the message, the take message that I would like to give to you today is that if you cannot identify where inclusion breaks, you cannot repair it. In hospital pedagogy, it's not about kindness. It's also about kindness. But it's about design system that protect the most fragile learners. Yeah? And I think this is our job as teacher. I have colleagues that don't think like this, but this is the academia. Someone is free to think how they want. And now I open 5 minutes the door for you, the floor, for your considerations or critical appreciation, whatever. Please.
Hello, Professor Gomez.
Hi, Dr. Flora.
Yeah, thank you very much for the insightful presentation. I'm interested to know for the students who do not manage their financial issues, do they get any assistance, or what are you doing about those students?
You mean the students in the hospital or the students at schools?
Yes, they are already at the hospital, but they cannot manage the financial
Mm-hmm.
for
Doctor,
the hospital pedagogy.
mm-hmm.
Yeah. Do you
Here,
assist them?
yes, here in the hospital school, I'm talking about Munich, yeah. Every
Yeah.
region in Germany have different schools, but here in Munich, they have enough material and they have enough support from another institutions. For example, just in the one hospital that I work with them here in the oncology, they bought these robots. They are avatars and they are not cheapers, but they give to the students to the students when they need for some time to bring to home and have connection with the schools. Yeah? Also, material support, they have it enough here. But again, they don't wait just for the government, they work with associations that support the children. Yeah? All
Okay.
children that have less possibility to buy materials.
Okay. I'm glad to hear that.
Dr. Gomez.
Please.
I'm Rosa Maria from Bari. I apologize for problem connection, but I would like add something about the profile A of students, because we approach with the oncologic and pediatric students in hospital school in Bari, with a bridge with their school, the student school, doctor and paramedic people as during daily routine. We don't have a problem like stigma with our pupil, because I wrote in the chat that music art therapy and digital technology through a stop motion studio project helps us a lot. So the problem of our students in this way, with the help of paramedic people and medical people, seems disappears during our lesson. We have the possibility to work in the world of the hospital for bedridden students, but we have an interesting space in our hospital school where peer tutoring activity happens. So for us, there is a special support from medical, paramedical, and psychology department. We work stretched between us.
And Rosa, can you explain to us how is this transition between the oncology and the regular school of the child from this student?
We support the students with a bridge about schooling education. So we organize a lot of activity with the teacher of each student that remain at home if their illness is particular severe. And so in this way, we help the students to grow up with scholastic activity during the year for the time that is necessary to remain at home, but with the supervision of the teacher that arrive in each home of the students that are illness. And there is a bridge between the home of each student, the house of each student, and their school where they study normally during all other the part of the year when it's okay with the and without illness.
Yeah, thank you, Rosa. I like when you talk because just for my colleagues from Tanzania know, Italy is one of the best countries in the things of inclusion. I know that's not perfect, but I have a student from Italy here. She finishes German, Italy, and she said that when she's in Italy, said that she studied special education. No one understand because Italy they don't have these special schools like in Germany.
No, there is not a special school. We have a hospital school and home education. The students stay in hospital or at home if it is not possible to remain in hospital after hospitalization.
Rosa,
And
do you know this is a big shock for the students here in Germany? When I say I know this, did you know this, Christina? That in Italy they don't have special education like here in Germany?
no.
It's normally it's a shock for many students because just in my faculty you have 5 different disciplines of special education: hearing impairment, mental disorders, speech.
Yes, but normally for special needs, special education, we act the inclusion because all the students remain in the classroom with a particular teacher for special needs students that work together and stretched connected with the teacher of the classroom.
Yeah, that way, Dr. Asha, Dr. Flora, Isa, and Lia Fura, Italy, it's, in my opinion, a good example. About here we talk too much about inclusion, but the better inclusion you can see more in Italy, in my point of view. This is the the reality. Thank you, Rosa, for your contribution. I think this is important.
Nothing, exclusively. With my pleasure.
So I read here the literature that I use it today, and in this point, I think if no one want to talk, I finish my presentation, and I thank you for the patience and for the audience and for the contribution. And next week we go forward with your thematic about inclusion in the education for students with in the hospital pedagogy. Okay, I wish you a good evening and see you next week.
Thank you.
Ciao, ciao.
Ciao.